I declare no conflict of interest. We described reserve bladder capacity as a bladder volume at maximum desire to void minus normal desire to void during filling phase in urodynamics. Bladder capacity in patients with detrusor overactivity (DO) is known as reduced bladder volume, so we thought reserve bladder capacity seemed to relate with urinary urgency and urinary incontinence in real life. However, little data concerning reserve bladder capacity is available thus far. Therefore, we present our reserve bladder capacity data and results of analysis of patients with DO. This is our reserve bladder capacity data. 60 patients were recruited who underwent UDS at our hospital. Urodynamic reserve bladder capacity was 230 plus minus 80.1 milliliters in patients without DO. 151.6 plus minus 88.1 milliliters in patients with DO. It reached statistically significance. In patients with DO, the urodynamic reserve bladder capacity in patients with normal desire to void at DO occurring was smaller than with normal desire to void before DO occurring, especially with terminal DO. Conclusion, we presented reserve bladder capacity data and the results of analysis of patients with DO and those without DO. This study shows that the urodynamic reserve bladder capacity in patients with DO was smaller than those without DO. It reached statistical significance. Reserve bladder capacity might become a factor to reflect urinary urgency and urinary incontinence in real life. Thank you for your attention.
Questions from the floor? If I understand correctly, this reserve capacity is more affected by the presence or absence of DO than from the presence of terminal DO in comparison to phasic DO.
Yes.
Is it like that?
Yes.
So there is no difference between terminal and phasic DO?
Terminal and phasic DO in terms of reserve bladder capacity is smaller than terminal DO. Sorry, yeah. Those patients with terminal DO is smaller than reserve bladder capacity than phasic DO.
So terminal is even lower.
Yes.
Yeah. It's lower in general with DO, and I see.
Yeah. I think this is a good concept, and it's analogous to warning time that we use clinically. And the question that I have is, did you also look at it as a function of bladder capacity? So we think that in many patients, most patients with detrusor overactivity have a smaller bladder capacity than those without. If you looked at the ratio between the reduced reserve capacity and the bladder volume in the two groups, did you look at that? And if so, was that different?
Yes. At the beginning of the study, I looked for the ratio bladder capacity and reserve bladder capacity, but the patient with DO is smaller than bladder capacity itself. So ratio there is no significant the patient with DO and those without DO in terms of ratio.
Okay, thank you.
Thank you.